My name is Kaye. I'm 76. I live with my husband Max, who's 93. I've been married to my husband for, 52, 53 years now. It started out as usual, and then all of a sudden my get up and go got up and went. I ended up in the back of the ambulance. There were that many people around, and my husband was in the ambulance too, while they decided whether he would stay or go with me.
Fremantle Hospital is our specialised centre for aged care, and we will try to directly admit patients to our rapid assessment and treatment unit. This way we can ease some of the pressure on the emergency department, but more importantly, we've now helped that patient's journey, getting them to the right place at the right time.
RATU, VEM and Choice together, which means VEM brings the patient to RATU, the geriatrician and multidisciplinary team gets involved, do what they normally do, have a plan for them, and Choice helps them to get back home and with a follow-up plan.
The collaboration between VEM, Choice and the RATU ward is a game changer for care of the elderly patients. VEM allowed us to actually avoid Kaye and Max coming to the emergency department. Choice meant that we were able to assess the couple the next day at the right time. And through Choice, we're able to actually keep Max at home, and we're able to directly admit Kaye onto the right ward. This is exactly the wraparound service that we want to provide and that our elderly patients deserve.
Kaye was obviously anxious about leaving Max at home because Max was dependent on Kaye for his needs to be met.
I was terrified, but people came backwards and forwards and reassuring me that Max was all right, up to the point of getting a picture of him sitting at the kitchen table. By the end of the third day, I was itching to go home. I was starting to feel better.
I think this is a very exciting time. I think this is the way forward, and I also feel that this is a service which is going to provide care close to home and help people return home.
So working with Kaye and Max has been a really lovely experience to see how we've been able to keep them at home. It's important to them both that they stay together, and it's really rewarding and satisfying how Choice can continue to make that happen for them.
We have found that this is actually a unique model, because bits and bobs of this whole golden triangle has been done in different places, but this putting all of them together is a unique model. And as far as I know, I don't think a lot of places in the world has been tried, and I think it is one of its kind in Australia.
Seeing Kaye and Max in their home today, well, that's why we try to do what we do. And seeing Max out there doing his crossword puzzles and Kaye walking around with their chooks, that's why home is where the heart is, and that's why we want to keep people in their home, and it could have been a very different story.